Awesome. Okay, well, I'm gonna go ahead and get started. Hello, everybody. Welcome to our second bi-monthly Community Conversations event. My name is Stefa Dragoon. I'm the Population Health Program Manager with the Oregon Office of Rural Health. And we're very glad you could join us for the second community conversation. This is really a new program from the Oregon Office of Rural Health where we can have these spaces to talk about emerging rural health issues, share resources and opportunities, and invite speakers to share their knowledge and also hear directly from you about the issues that are impacting your community as well. We're just, yeah, really excited that you're here. We're really grateful to Stephanie Hooper and Vanessa Becker for joining us and sharing their expertise and experiences with us today. So thank you. Um, Sarah, would you mind going to the next slide? Thank you. So, like I said, this is a new program that our office has initiated. Here is the schedule for the rest of the year. It's every other month. So today we'll be talking about supporting older adults in rural Oregon. Um, in May, we're going to be talking about supporting Oregon's critical access hospitals and rural health clinics. Then in July, we'll be addressing workforce shortages in rural Oregon. September, enhancing population health in rural Oregon. And in November, we will be celebrating National Rural Health Day. So you can also see the event schedule and register on this link I'm about to put in the chat. You do need to register for each event independently, and the links are all on the website, so you can access that. Yeah, thanks. So here's the agenda for today. We are going to hear from Stephanie Hooper of Age Plus, who is going to share her knowledge on the state of aging in rural Oregon. Next, we'll be hearing from Vanessa Becker of Douglas Public Health Network, who initiated a program to support emergency preparedness for seniors in Douglas County. And they are actually a grantee of our Elder Service Innovation grants, which I will talk about on the next slide. Oh, it looks like there's an echo. Stephanie, would you mind muting? It might, let's see if that works. Oh, thank you. Okay. Um, so the Oregon Office of Rural Health has had a strong focus on supporting rural elders. We have three major programs, including the 2023 Forum on Aging in Rural Oregon, which is coming up this May. We're really excited about it. We have a great lineup of speakers, including Stephanie and Vanessa, so we're getting a little sneak peek of the forum today. It's happening May 15th through 17th in Seaside, and I can put also in the chat. Sorry, are we still echoing? Oh no. Okay. Um, okay. It's resolved. Sorry, just making sure it's okay now. Okay, so yes, we have the forum coming up, and I can put that link in the chat. It's also, you can find it at ohsu.edu/forum on aging. We also have the Elder Service Innovation Grant, which is a program to support programs that are innovative in their approach to healthy aging in rural Oregon. And we are about to release the request for proposals, which is going to be released on April 3rd, and then proposals will be due on May 8th. So just keep an eye out for that. Again, I'll put all of these links in the chat so you can check them out. Multitasking is a little hard right now, so stay tuned in a few minutes. And then we have also initiated an online community for professionals who work with older adults in rural Oregon, and that's called the Aging in Rural Oregon online community. It's hosted on the app Slack. So I will also put a link in the chat for that. And it's really a great space where folks from across Oregon can share resources and opportunities, share their expertise, and just, really communicate with each other and build that community. So That is all I have for my piece. I'm really excited to introduce Stephanie Hooper, who is the president of Age Plus, who's going to be sharing more with you all today. So Stephanie, please take it away.
Thank you so much, Stefa. And there's still no echo, is that right, everyone? Thumbs up or let me know if the
No
sound.
echo anymore. Thanks, Stephanie.
Thanks. Well, thanks for having us here. This presentation has been a team effort. I'm just delivering it. We have a great team, and some of them are even on the call today here at Age Plus. We're a nonprofit, a statewide nonprofit that was originated in 2018. And really our goal is to empower communities of all ages to support and care for older adults, but especially in rural areas, those that are low income and underserved. And we do this through policy advocacy, strengthening networks, developing innovative programs, and celebrating the strengths and contributions of older adults. Go ahead, Sarah. So if you don't know already, our demographics are significantly changing. And in less than 10 years, we are going to have just as many older adults as we do children under 19, under 18. This is going to be a permanent change. We are basically going from a pyramid age structure to a pillar. And it's not going to be wavy. It's going to be a pillar. So because we're living longer, we're having fewer children, without major immigration reform, this is our future state of our populations. And some rural areas are getting even more older adults as a percentage of their population. Go ahead. So you can see here that the stars are counties that have already 25% of their population are 65 plus. There are some counties that will reach by 2030, up into the 30s, 50s, 60%. So for example, Jefferson County will be 34%, Coos County 36%, Deschutes County 61%. And that's of 75 plus, those three higher percentages. So overall, the 65 plus is going to grow, but we're going to have significant changes in that 75 plus too. Go ahead, Sarah. So what's this mean? It's not just an alarm. Of course, there's going to be more demand, but there's also a lot more opportunities. And that's a principle and a guiding value that we really hold on to at Age Plus, is that it's just about the opportunities and strengths when we're working to improve the lives of older adults, not just from a deficit standpoint. So while we know that our future olders will be financially constrained, they will be, there'll be fewer people available to care for them, but they're also going to be more diverse, where they're going to be vital contributors even longer than they already are. Go ahead. But here are some concerning percentages in terms of the behavioral health of older adults. So a significant portion are feeling depressed, are isolated. And this is just who's reporting it. And so I think that the true numbers are probably even higher. Go ahead, Sarah. COVID was a wake-up call that really showed us just how siloed our services for older adults are, and intensified and really shone a light on what's to come. So what we need to prepare for. We need to prepare for isolation prevention. We need to prepare for more culturally appropriate services. We have to figure out transportation for rural and suburban areas, which really weren't developed for non-driving folks. But really, COVID, the ultimate thing it unveiled was really the state of ageism. When uh, 5,000 people, 65 plus, died from COVID just in Oregon. And that wasn't just because they were the most vulnerable, but the way we rolled out our vaccines, the way they became invisible, uh, that's really the true price of ageism, which seems to be the last acceptable ism. Go ahead. So our older Oregonians are going to be cost burdened. These are the median incomes for men and women. And not only is that a huge disparity, but overall, it is incredibly low. And so older adults are going to, we want them in workplaces. They're going to need to work too to offset their fixed incomes. Go ahead. Housing and suitability is a big factor. The not only from a cost burden standpoint, many older adults, all of their assets are held in their house. So to be able to tap into that, they have to move. Usually it's harder for them to move to an urban area. And we know that there are so many older adults also living alone in their houses in rural areas. So really, we're looking at reduced access and to basic services in suburban and rural areas. We're looking at limited housing design that's acceptable for older adults, the costs, but we also have opportunities. Age Plus, I won't go into it here, but we are developing 2 projects right now for low-income older adults that are 100% accessible in rural areas in Talent and Madras. Go ahead. So I mentioned briefly the distance burden. So our rural and suburban communities were not set up for people that don't drive. So this is a significant challenge to overcome, to either bring services to older adults or to come up with better ways to get older adults out into the community. Go ahead, Sarah. And again, I want us to have a really balanced view of older adults in rural areas. That's not all about the challenges. There are many strengths. And we see it every day in our programming and in our conversations with communities and convening opportunities. There is a pull up your bootstrap attitude. There is a level of volunteerism and helping each other that is unsurpassed in other areas of the state, in more urban state areas. So we need to leverage that. We need to look at those networks. How can we help them connect better? How do we make sure people are connected to them and that they're providing services that everybody needs to thrive? Go ahead. So one example is Age Plus Circles of Care. And this program is currently running in the Dalles and Hood River, and it's going to expand to Madras and Talent. And really, it's a matching program of volunteers helping neighbors. So we match older adults with volunteers to help them with light chores, friendly check-ins, nothing licensed, but it could be anything from a phone call to a walk to helping them on garbage day to make sure their garbage cans are out, or a ride to the grocery store. So it's really, we've worked hard to make this program scalable and so that any community could adopt it. But it's also a circle because, again, we believe older adults have just as much to offer as to receive. So an older adult that maybe doesn't drive would still be able to do friendly check-ins or share a recipe, or however they can contribute to their community so that they feel like they're having a purpose. us as well. Go ahead. The other opportunities in Oregon, really need to be focused on. So we know that telehealth is a great option, but we have to get broadband access to the rest of Oregon for that to be an option. And we have to build our workplaces to have multi-generations in the workplace, job sharing ideas or reduced shifts, all of those things, so that we are embracing and supporting and succeeding from having many generations in the workplace. And in terms of technology, it's not enough just to have devices. We need to also have training for these devices and ongoing support to support everyone with technology. Go ahead. So this is why Age Plus, one of our major initiatives, is to advance a multi-sector plan for aging. Bottom line is, this changing age structure is not just about older adults. Everyone is aging, and if we prepare as a society for everyone to age well, where we support family caregivers, we create intergenerational connections, everyone's going to benefit. So it really takes an all hands on deck approach and a multi-sector approach, because aging affects nearly every sector, from healthcare, employers, universities, technology, but we don't have a concise or even ongoing approach. We haven't even started, and we are less than 10 years from having, the age structure that will require different resources and different opportunities. Go ahead, Sarah. So the multi-sector plan, we're calling it Shared Future Oregon because it's about all of our future, is a 10-year blueprint that supports services across the lifespan. So there's a bill in the legislature right now, HB 8961. Julia can put that in the chat. I know she's on. I know I just butchered the number, but it calls for a stakeholder committee to come together to start building the framework for a plan. Regardless of how far that legislation may get, we have very positive support from the governor that she knows this needs to happen. It may or may not happen through executive order, but we are going to make it happen. And it really needs to be a public-private partnership, because there just aren't enough resources in government alone, or the innovation in government alone, to really set our path for how we want to age in Oregon. Sarah. So that's a little bit about the state of older adults in Oregon and what's on the horizon for where we have opportunities to change. Next month, Julia's going to put in the chat, we are celebrating the contributions of older adults in our communities with Age Plus's annual Ageless Awards, and you can register and watch via live stream, or if you're in the Portland area, join us. But it's an inspiring event, and where we highlight these amazing individuals who are 75 and older, who continue to give back to their community, and you can't help but leave with a smile on your face. So thanks very much.
Awesome. Thank you, Stephanie. We're all giving our virtual applause. Thank you for all of your information, and that's super helpful to hear from your perspective. So thank you. So I'm going to queue up Vanessa. And just a heads up, we're going to save questions for both Stephanie and Vanessa to the end. So we'll move through this presentation, and then we can open up the floor for questions. You can raise your hand, you can put them in the chat, and we can go over some questions and have a little bit of a moderated conversation. So next I want to introduce Vanessa Becker, who is the Public Information Officer at Douglas Public Health Network and is also an ESI grantee, and I'm very excited to hear more about her project. So thank you and welcome, Vanessa.
Hey. Thank you, Steph. Can you all hear me okay? Excellent. Well, thank you so much, and what a great presentation, Stephanie. And I will say the same as you began, which is I am just going to be speaking today about a team effort. We have several folks at Douglas Public Health Network, which we also call DPHN, who have been really key in this project. So I'm just here to talk about it today, which is my pleasure. So next slide, please, Sarah. So a few things that we're going to cover today, as Stefan mentioned earlier, I will be working and presenting with our executive director, Teresa Mochler, in May at the forum in Seaside, and we'll have an expanded version of this. But today we're just going to talk about just in general senior emergency preparedness and why is it a need. And then I'll highlight some of the project elements of the Elder Services Innovation Grant Project, and then we'll talk about next steps. Next slide, please. So this might be obvious for a lot of people, but sometimes it's not. So one of the questions we oftentimes get in our work in emergency preparedness is, why is this even important? We do know that the frequency of hazards, particularly in rural areas, such as wildfire and severe weather events, are increasing. And being prepared can make the difference between a life or death in a disaster. Being prepared also helps to build resilience, both individually, as a family, as a community, and as a county. And it also helps to improve recovery. And being prepared can also decrease anxiety, fear, and loss that happens as a result of the disaster. So thank you, you read my mind. So one of the other questions that we frequently get, and when we started this project, I think it was about this time last year, we identified that seniors really had some different challenges when it came to emergency preparedness. And so a couple of scenarios that we ran into that we saw in some of our discussions, one was evacuation considerations. So one of the things that we know and what we see in rural areas, and particularly with people who don't have a lot of transportation or can't drive, is that they might want to evacuate on level 2 or level yellow as opposed to wait until the go time, which is level 3. That's one evacuation consideration. The kit that goes in your emergency kit will be different for seniors. It might include 2 weeks of extra medication. It might include some durable medical equipment like oxygen, that sort of thing. We also know, as Stephanie also pointed out earlier, that we have a lot of very isolated seniors, physically isolated. I was meeting with the Meals on Wheels folks just a couple of weeks ago, and we were doing a training on this project. And they mentioned that they rolled up to somebody's house in rural Douglas County, southern rural Douglas County, and there was a bear in the front yard. No kidding, there was a bear. So they had to call the senior and say, don't come out to get the food, and we're not coming in yet. We're going to wait until the bear leaves. I don't think that's something that typically happens in an urban area. And so the sense of isolation, both emotionally and physically, is very high in our senior population, particularly in the frontier areas. We also know that seniors have the effects of many hazards like smoke or severe weather affects their health more than it does people who are not older adults. Another thing that we ran into just this last summer when we had rolling blackouts for wildfire risk, when there's a rolling blackout, you can't use a generator. So there's a fire risk in some disasters for that. And if somebody has oxygen and needs their generator, they're not able to use it during that time. So again, it's all these things that are considerations for seniors that add to the complexity of emergency preparedness for seniors. Lastly, I just found out about this the other day, and I hadn't thought of this either. Most of us all know that we need to have smoke detectors in our homes, but a lot of seniors and older adults are not able or not willing or really shouldn't be climbing a ladder to change those batteries. So there are programs through fire departments to come out and assess for smoke detectors and put you on a regular rotation to change those batteries. So something as simple as that, these are all considerations that you maybe wouldn't think of and just general emergency preparedness. Next slide, please. So the grant itself, so as I mentioned, we started thinking about this last year about this time. And so we reached out to our partner, Douglas Senior Services, which is a county-run senior services program, and talked with them about this need. And we also had some additional support from the Sheriff's Office Emergency Management Division. And so between the three agencies, we were able to leverage a lot of expertise, a lot of networks, and some funds. So some of the expertise and networks that this grant tapped into was emergency preparedness, obviously, public health, communications, and also working with seniors. And particularly the two programs at senior services was Meals on Wheels, which provides over 200 home delivered meals throughout the week, throughout the entire county. And by the way, the county itself is about the size of Connecticut. So there's a lot of isolation, a lot of driving, and a lot of very really frontier communities. And then, so we were able to, we applied for the ESI funding, we were granted that. And then the county, Douglas County also put in a sizable amount of money, as did DPHN from our public health modernization funding. Next slide, please. Next slide, please. Thank you. So this is just, I'm actually go through these a little more in the following slides, but some of the projects and things that we put together since we were granted this, and we started this actual rollout in July. So we created the infographic, which is on the left-hand side there, and I have one slide that has the whole thing, so we'll go through that quickly. But this is just a quick snapshot. It's a legal size paper. It's laminated and it's going in the kits, what we call the starter kits that we have. And so I'll go through that here in a minute. In the middle of this slide, you'll see this is actually a picture from a wildfire, the Archie Creek fire in 2020. And this is a 57-page family preparedness and response packet. So we have putting that together. Now this is more for all ages, but it is a really good resource and goes through a lot of ways about how to prepare, what kind of kits do you need, what do you need to do for your livestock, that sort of thing. We also have the infographic in Spanish, and then on the far right of this slide, you'll see our starter kits. So the backpacks, and I'll talk about what's in here in a second, but these are backpacks. They include the infographic, they include the booklet, and they include a first aid kit and several other small items. Okay, next slide, please. So this is just a blown up version of the infographic that we created from scratch. And these are the top 10 things you or your loved ones can plan to stay safe in an emergency. We also prepared this not only for older adults, but also maybe their caretakers or people that are coming into the home or family to sit down and have a conversation about emergency preparedness and what does it look like for you if you're at home and you're an older adult. So a couple of things I'll just cover here quickly. Creating a network of support, preparing emergency supplies, keeping a 2-week supply of medication, having a go kit or a bag, having a communication plan, making sure you have copies of your Medicare, Medicaid, other insurance cards, backup of cell phone. Next slide, we'll see the back of the infographic. And so what we did for the kits is we gave them, what we're going to do is give them what we call a starter kit. So it has some of these things that are on this checklist. And then we also have an area, again, it's laminated so they can put the communication plans, you know, where am I going to go if I have to evacuate, who's going to come pick me up, or where am I going to go drive to if I can drive. And so that's all really helpful. Next slide, please. And so what we put in the starter kits included a space blanket, wooden matches, a lantern with batteries, a poncho, first aid kit. We also had an interesting and really great relationship with a local freeze-dried food company, and they were able to label, and we had actually 2 packages of freeze-dried food, which should last, I believe, 3 days each, that are also in there, and we actually had it branded for marketing and specifically have our logo on it and everything for those starter kits. So that was kind of great. Disposable gloves, masks, water sanitation chart and dropper with bleach, the 57-page emergency preparedness booklet that I mentioned, hand sanitizer, emergency signal, an alert flyer about how do you sign up for Douglas County Citizens Alert, which is a really good program, the infographic I mentioned, toilet paper, and a flashlight with batteries. And the idea with this starter kit, actually next slide, I'll explain that. Oh, we have additional materials that we're going to have when we present these particularly at the meal sites. And that's the grab and go binder. So this is a much larger binder. It has documents in it. It's got either laminated or put in the plastic sleeve so that you can just grab that. It has insurance information. So we'll have an example of a grab and go binder for the presentations. We'll have a car kit, which is an emergency car kit, emergency preparedness car kit. We also have purchased with the grant funds several NOAA radios. And so the thought is if people pick up a packet and a starter kit, and they come back to the senior dining site a month later, and they filled everything out on the list, they will be put in a raffle for a free NOAA radio. One of the other things that was interesting, so we initially were going to purchase some newer, fancier NOAA radios, but we realized that they needed to be programmed. The one that you see in the picture here is actually, you don't have to program, it's just like a regular old time radio. So we figured that would be a lot easier for seniors to use as well. And then we also have some flyers that we're going to be handing out at the presentations, particularly about back to that smoke detector issue that I mentioned earlier about batteries and what that program is. It's actually a U.S. Fire Administration and CDC program. So we're going to be providing those information pieces and flyers out as well. Next slide. So I think I'm missing a slide here, but so some of the barriers and challenges when buying in bulk, you often get mismatched numbers of items. So we ended up buying 400 starter kits and items for 400 starter kits, but we have some extras of many things, and we had to go out and purchase things that didn't come in bulk differently. So that was kind of a bit more of a challenge logistically than we had expected. Also, storage of kits requires a lot of space. So the funny thing I should have taken a picture of is our office space. Everybody in the entire building on the floor has some of these bags stored in their office, and they're filling the hallways, and we're worried people are going to trip on them. So just make sure you've got space. Printing and design, always budget what you think you'll need and use for a professional design person. Make sure you take time for onboarding and devote staff and support training of those staff. And then the other really important value in this process is that we want to create space for conversations, not just handing out things. So I think the slide that I missed somehow, I'm not sure, maybe I went through it too quickly, but was that the actual project itself was not only getting these items, but also training. We have 2 part-time emergency preparedness coordinators and outreach staff that are going to be going out to the dining sites. We have 7 dining sites. The first one will be next week. And they'll be presenting this. They'll be giving out the kits and the starter kits and talking to folks. And then after that, they will be going to over 200 Meals on Wheels locations and homes and sitting down with older adults and talking about what does emergency preparedness look like for you? What are the things that you still need for your kit? That sort of thing. And so again, that's the value of the project, is it's not just about giving people things, it's actually having a conversation about how can you be more prepared, because we know that another disaster will happen. We don't know when, so it's good and important for us to be prepared for that. Next slide. So the next steps, the first, as I mentioned, the first of the 7 dining site presentations. So the dining sites are run by Senior Services. That first one is going to happen next week. And then after that, 200 home visits begin in April. And then we also applied just last week for an AARP flagship grant, which would expand this program and enable us to purchase more kits and actually start getting into senior living communities. So these could be independent living facilities. They could be 55 and older senior trailer parks. So it's really, really been well received so far, and I think that with the expansion, it would be great to be able to get more out into the community. So we're hopeful that we will get that grant. And I think that's it. Thank you so much. And we'll take questions, right?
Awesome. Yes. Thank you, Vanessa. Another round of virtual applause. Thank you so much. I think it's really amazing to see such a great example of a case study of how your community has come together to support older adults when it comes to emergency preparedness. So thank you. So now we can open up the floor for any questions. Invite folks to put questions in the chat, or if you want to share comments on how your community has addressed supporting rural elders, we would love to hear from you. I'm gonna move us to the stage, and then we have Cheryl, who's raised their hand. I'm gonna unmute you, Cheryl. I think you should be able to unmute.
Cheryl Hudson. I'm 76. I'm still a part-time caregiver in LeGrand, and I was just concerned that a lot of people are incontinent, and is there going to be any consideration about that when we're taking people, because that is a real big thing with the people I take care of. Thanks.
So, Cheryl, I'm sorry, I'm echoing a little bit. So your question is around incontinence when it comes to emergency preparedness?
Right. Yeah, because I mean, what are they going to do? Are they going to have anything to help with that? Or yeah, that's just what I'm concerned about.
Yeah, so that's a really great question. So in some of the conversations, particularly in the family booklet, I believe there are some suggestions for, what would you need to take with you if you have to leave your home, or if you have to leave wherever your shelter is. And one of those things is incontinence supplies. So I think we actually even put that on the infographic. So as a way to plan for that, you want to make sure that you have extra incontinence supplies. The other advice that we make in emergency preparedness is for folks that are running a shelter or are creating a shelter for evacuees, is to make sure that they do have incontinence supplies. We ran into that actually during the Archie Creek fire, where we had several displaced seniors from the area, and we were in public health. We were actually running incontinence supplies over to them for that exact reason. So you're spot on.
Thanks, Vanessa. And we have a hand raised by Jamie LaCour. Think you can unmute yourself.
For the information, and I work for the Council on Aging of Central Oregon, managing our social engagement program, Caring Connections, which is a phone-based program designed and implemented during the pandemic, but we are really wanting to expand to more, creating more opportunities for in-person socialization and also for more in-person, in-home support. And this question is for Stephanie. I'm curious to learn more about circles of care, and particularly one of the hurdles, besides obviously transportation, which is a whole thing unto itself, but I'm curious to learn more about how in that program you are ensuring the safety of volunteers. Many of our clients do receive in-home assessments from case managers, can then make an assessment of a home and say this is a safe environment for a volunteer, but we also have many participants who do not get that assessment. And so, yeah, wondering if you could share a little bit more, or even context for talking about safety insurance for sending someone into someone's home.
Absolutely. So, are you getting an echo, Steffa?
I am getting a little bit of an echo, but I think not anymore.
Our program for Circles of Care are run by community liaisons, local people from the local community. And so part of the interview stage for any client or volunteer, well, not for a volunteer, but for a client, is a home visit. It's not a traditional assessment. And Circles of Care is not, about any kind of licensed services. It's really neighbors helping neighbors. So, but it is important that we know what kind of situation we're sending a volunteer into. And so that's why we do a home assessment. and I shouldn't say assessment, that's too formal of a word, but we have a checklist that we've developed of things for the community liaison to identify, be aware of. You know, there's a little interview, and so that's our measure of making sure that we know where we're sending a volunteer.
Great, that's good to know. I appreciate you sharing that. And I would love if it's possible to connect with someone about seeing what that checklist looks like, because we are kind of trying to develop some protocol in that area. So
Yeah, I will put my email in the chat.
awesome. Thank you so much.
Awesome. Feel free to raise your hand if you have questions. I'm going to try to unmute Liz because I know they have a question.
Steph,
All right.
while you're doing that, I have a follow-up question on the safety concerns for volunteers with the Age Plus program. Are there any liability concerns, Stephanie, that have come up? I was just curious about that as we were looking at your slides and listening to how the program's set up.
Well, we have imagined all the liabilities that we can in the development of the program, and worked with our insurance company, really under our general liability insurance. Volunteers are treated just as employees in terms of how they're protected and around their actions. So does that answer your question, Sarah?
Yeah, it does. I was wondering if your organization's liability insurance might cover the volunteers who are working with them, and you didn't have to do a special rider for them.
There are some special riders, but like for instance, we're doing one on theft, but no others.
Great, thank you.
Awesome. And now, Liz James, you are unmuted.
Can you hear me?
Yes.
Great. Well, first of all, great presentation. And just so that folks know who I am, my name's Liz James. My pronouns are she or they, and I wear a couple of different hats, one of which is the chair of the Oregon LGBTQ plus Aging Coalition. And I'm very excited about this program. The whole coalition supports the need to see and prepare for not only the adults, the older adults in all of our communities, and rural in particular. And I live in Southern Oregon, so there's a lot of rural communities around where I personally live in the state. But I just wanted to mention there are, and I want to acknowledge Age Plus for their work around actually producing a number of briefing papers for what are often, they're invisible marginalized communities. They're people of color, indigenous populations, and certainly LGBTQ older adults. So just a note, there's a lot of different ways to reach community members. And it does sometimes take work, but wherever possible, incorporating images or identifying that all folks and being specific. I think a lot of times there is an inclination to say, well, we don't discriminate, we include everyone, but people are looking, I think individuals in different populations are looking for visual cues about that. So, I know that that's the intent, but I would be remiss if I didn't just chime in and add that. So again, thank you to the Oregon Office of Rural Health. Great work, and to Stephanie's group and to Douglas County for the great work. Appreciate it.
Awesome. Thank you, Liz. Does anyone else have any questions or comments? Anything you want to share? There's a question if there are if other states have a similar program like Shared Future Oregon.
Yeah, actually, this is part of a national trend happening right now. And Oregon and Age Plus are part of a 10-state cohort with the Center for Healthcare Strategies that are all working together to advance and share best practices around multi-sector plans for aging. So we have a roadmap. We don't have to create the wheel. We get to be innovative and make it our own in an Oregon unique way. But we've got a lot of tools. We just have to we've got to get the leadership in Oregon to say this is a priority and we're going to support it and resource it. Because if we don't now, the fiscal implications in less than 10 years are going to be significant.
Great. Thank you, Stephanie. Other questions, comments? Well, awesome. Thank you all for coming, and thank you, Vanessa and Stephanie, so much for sharing with our audience. And just a reminder to everyone, the Forum on Aging is coming up. If you have more questions or want to connect with any of us, we'll all be there. Stephanie is presenting, Vanessa is also presenting. I'll be presenting, so we'll all be there. So join us. It's May 15th through 17th, and there's information in the chat. I'll put it again, ohsu.edu/forum on aging. And great, thank you. Have a great day, everybody. Take care.